Hi. Hi, Alicia.
Okay, we are ready to go. We're running a little bit behind. For the court recorder, we have Frida Wang on the line, the chair of the finance committee.
If you speak in the boardroom, I can't hear you at all. So when you go on the record,
Okay. Hello, can you hear us now?
yes, because you're masked and obviously you have to be, I can't tell who's speaking at any given time, so you'll just have to state your name before you make a comment. Sorry.
Okay, so on the call, we have Frida Wang, the chair of the finance committee. We have Jose Pagan, the chair of the board, Fineski Pena Mora. We have and Sally Hernandez is also on the line. We have established quorum. Frida, when you're ready to start, we can go ahead, okay?
Felicia, is Barbara on? Did you say? I'm sorry.
She is trying to get on. She would join as soon as she's connected, but we can start. We have quorum.
Okay. I'll start now. Welcome. Welcome, everyone. Thank you for joining us today for the meeting of the New York City Health and Hospitals Finance Committee. Today's meeting is officially called to order. I would like to propose a motion to adopt the minutes of the Finance Committee meeting held on June 11th, 2020. I will go through and poll each member individually. Jose, Chairman Pagan?
Yes.
Dr. Katz?
Dr. Katz stepped away for a moment. He'd be right back, but we have quorum. We can move ahead.
Okay. Sally Hernandez Pinheiro?
Yes.
Benioski Peña-Mora?
Yes.
And I vote yes, so the minutes are adopted. I'm going to move on now next to John Allberg, our Chief Financial Officer, who's going to provide a report on our financials. John?
Hello. Can you hear me okay, everyone? Hi. And if I drift off, just nudge me. Thanks for sharing your time with us. It's great. It's great seeing everybody. What we thought we would do today is recap our FY20 performance for the period ending in June and show you some of the pre and post-COVID trends, which we think is interesting to see from a binary perspective, how the system performed. We'll start looking forward to FY21. We've developed the budget. We went through a 3-phase budget process, with facilities. It worked out, I think, quite well. And we're clearly in the execution phase. So we'll review elements of the budget with you. And then we'll close with a recap of FEMA and federal relief with Linda, and then a T2 update. So that's our agenda for today. So moving to the first slide. I think to characterize, how we did from a financial perspective, I think very similar to the system itself during COVID, we performed very well. And I think even to look at the numbers, we closed even stronger, right? Our last quarter was very strong, primarily driven by, COVID revenue. But our closing balance was about $90 million higher than our adjusted COVID budget. So we finished with a closing cash balance of $688 million. Our net budget variance, we beat the budget by 2%, which is really quite remarkable. We had as our own internal goal is to have every facility kind of stand on its own when you look at their revenues versus their expenditures. And our goal was that every facility would show a positive margin. At the end of 2 years, and we did that, basically this year. Every facility had enough revenue to cover their budgeted expenses, and that was very remarkable. Patient care receipts came in $166 million higher than we had planned, and I think when we'll go through the presentation here, when you look at our actual patient care receipts, 19 compared to 20, we actually increased by almost $500 million, which is quite remarkable. I think it's important to also highlight here that when we present the numbers, we're trying to give you a perspective of both with and without the federal relief, right? So we try to neutralize that so you can actually see our underlying performance. So I do want to make sure that point is clear. We try to show it to you from both perspectives. On the transformation plan, again, even despite COVID, we kept moving forward. Revenue cycle, beat our target, brought in 286 million, 340B. We did better than target, bringing in 54 million, and then enrolling the uninsured. We have more work to do here. Certainly, it's one of the highlights of our FY21 plan, but we continue to do a better job at enrolling the uninsured. I think it's also important that we've continued with our investment plan. This has been very important to us and Dr. Katz. We need to have the right, cohort of clinical staff to appropriately resource our facilities. RNs and other nursing, positions up 116 and 138 jobs for the year. But when you look at it over really at the 24-month timeline, which is when we started this, we've added almost 900 positions in those two categories. So I think we've done a great job. Nurse staffing model is pretty much set. We have a little bit more work to do in the area of the ED, which we're working on, but I think quite remarkable there. Rev cycle operations, with the additional 83 jobs, I think we're pretty much there, right? I think we have a full complement of revenue cycle staff, and we're at this point in our development where we're spending a lot of time through our training center, having ongoing training sessions with not only the rev cycle staff, but also physicians and providers. So, and then lastly, in the budget is, the COLA, additional resources for both NISNA and Doctors Council. I would say where we sit today, I think we've pretty much resourced the expenditure base. We have done a lot of work with these staffing models with nurses. We're doing a staffing type model for our physicians. So pretty much the major elements of, the major staffing functions, we've either have already developed staffing models or they're in place. And I think for the most part, resources are in the budget. So that was certainly one of our accomplishments for the year. So moving on to the next slide. This slide, I'll just kind of start it and hand it off. I think Salima's doing this. We tried to, the next slide. So we packed in about as much information as you possibly can in one slide. But what we're really trying to do is give you the perspective, utilization and revenue, right? The pre-COVID, the COVID period, and now post-COVID. So I think I'm turning this one over to Salima. Salima, are you there?
Hi. Yeah, so as John said, we tried to illustrate here for you the trajectory of our volume over the course of the pre-COVID up to our reopening stage through August. So you can see the first slide, we separated out our risk volume from our non-risk volume, and then we added in a little area where you can see where the testing has allowed us on the outpatient side to kind of get back to target. So currently we're still at 20% below baseline there. And then when you look at your ED is 43% below baseline. So you can see that our ED is not coming back as dramatically as our as our AmCare. And on the outpatient side, same trend. You can see that we kind of peaked in the COVID surge period, which allowed our revenues to increase. And then we came down dramatically in the immediate post-surge, but we're starting to ramp back up. So currently we're at 26% behind baseline target. One thing to note there that I know jumps out at you on this page is that 74% of our lost volume comes from our subcap lines of business. So there is potential to recoup a lot of our losses through the risk pool there. Any questions?
Okay. I'll keep moving forward. Next slide. So here we're, if there's things that keep me up at night, right? It's really the things that are external to health and hospitals. And I think internally we have a plan. We're implementing on that plan. It's getting stronger every day. You can kind of feel that momentum. but it's the things that are really outside of our control, right? And I guess I should just, roll over and go back to sleep because there's not much I can do about it. But plan and anticipate, right? Making sure we have backup plans to whatever comes our way. And I say, the thing that taught me about COVID is that we are a more resilient organization. We certainly took a punch, and I think you go through the numbers here, you'll see that we perform, quite well. But the things that are concerning really is the state's finances, right? They reported a $14.5 billion deficit. I think their total budget is somewhere around 170 billion. So it's a sizable percentage on their budget. I've been doing budgets a long time. I've not seen a deficit, even inflation adjusted, that big. I think the governor even admits, right? It's almost too big for the state to handle, and we're going to need, some help, from the federal government. But they have reported, right, a plan to cut, Medicaid 20% and education 20%. Those are just really unsustainable cuts. So we'll certainly continue our advocacy for greater, federal relief, even at the state and city level. I think the other thing concerning is just, the second surge, right? That drains a lot of resources, right? James will go through this. We're taking steps to make sure that we have enough cash in the bank. But maybe unlike other, hospital systems, and we've spent all of our CARES Act funds, right? It's come in and we spent it. We may replace it with, FEMA dollars, but we've spent, and we certainly appreciate every dollar that we've received. We went above and beyond other healthcare systems, right, in terms of responding, to the pandemic and doing things, to protect the public health. But certainly a second surge would have us concerned. And 340B is a policy that was in the state budget. It really eliminates rebates the safety net providers receive. Those conversations are still ongoing. We're fighting back on that. We think there's a better way to generate savings for the state other than that particular proposal. So those are the risks. On the opportunity side, the DISH cuts, right? We talk about that at every session. Those cuts have been, restored or further delayed through the last, CR, and I think through December 11th. So it remains certainly in Congress's mind as a valuable resource, and it's our hope that the DISH cuts will be delayed for a more permanent period. We certainly were advocating for that. I think the bright spot, and this is what Salima referred to, is, we are a large portion of our revenue stream comes to us through a fixed source, a subcap payment. So that's why we look behind the numbers and see of that lost, volume that we've translated into lost revenue. Well, in essence, those dollars could come back to us, and more than likely will. We expect that they will, through the risk pool payment. So if you've underutilized services, and this is something that is throughout the system, we know that the pandemic, suppressed more the kind of the voluntary healthcare services. That's going to result in greater risk pool payments to us. So that's a bright spot. And we know, plans are reporting 8 to 10% underutilization. Again, those are dollars that in a risk arrangement would come to us. In a non-risk arrangement, they would stay with the insurer. So those are, those are kind of the risks and the opportunities. We'll keep a very close eye on all of this. James, did you want to do the next one?
Sure, I'm happy to. James Cassidy. So just looking at our FY21 cash projections, as we've talked about, it's always something that we're monitoring very closely. We closed September with about $650 million cash on hand, which is about 30 days. The main reason that our cash was able to increase was that we received $225 million in DISH funds that we've been anticipating since about March. I think we talked about it at the last two meetings. It's a little bit less than the total $325 million that we had been anticipating, but it's certainly beneficial for us, and we're continuing to push to see if we can get those additional DISH dollars. Given that the 30 days cash on hand, it's obviously something that we're consistently needing to work with the state and work with the federal government to push revenues in, especially as we're anticipating a potential COVID second surge. And so right now, We expect to close October with about 18 days cash on hand or $400 million. But we've already, reached out to the state to ask for, expedited dish payments, both for the remaining funds for $325 million and also for funds that we normally get in the third quarter or, the January to March period for us. I'm going to try and get that in the second quarter between October and December. In addition, and we can get into this a little more detail later, but we've expedited our FEMA package for temporary staffing to the federal government in an attempt to get these revenues in this quarter as well. But we can go through that in a little more detail in the federal relief slide. John, anything else to add?
No, I think that's great. No, we sent a letter off to the state, to both the Medicaid director and the budget division last night. And we're hoping for a response. We're not asking them to spend any more money. We're just asking them to give us money they'd otherwise provide to us a couple of months earlier. Next slide. Oh yeah, this is a slide I like. I'm not sure if everybody else does, but I think it really we know that the state had, and the federal government, right, took steps to make sure that people have Medicaid coverage, and they continued the eligibility period, which I think is a very smart move in the midst of a pandemic. But that has really worked well for us, because when we break out both Metro Plus and Health First, our attributed lives, and each life, right, drives a revenue stream to, health and hospitals. Between the period of January and July, we saw an increase in our attributed, covered lives of about 37,000 people, which is almost a 10% increase. You see something, very similar, as it relates to Health First. And again, each one of those lives drives dollars in to health and hospitals. And I think if you add it all up, it's over $200 million. So I like the way Salima, states it. It's like, it's our dollars to lose, meaning if we keep these folks in our system and they don't seek services outside our system, those dollars will stay within H&H, right? And that's one of our strategies, big part of our FY21 budget strategy. The other, right, and this is actions that we're taking now, is to make sure that we kind of cement this loyalty to health and hospitals, right? Presumably, right, pandemic will, subside, we'll get back to normal life, and hopefully people will, get jobs and return to work, but we want them to continue their health care with health and hospitals. So we're developing strategies both with Metro Plus and ambulatory care to evaluate, who in fact are these people that where their insurance, will eventually lapse, and make sure that we're engaging with those patients if we haven't. So this is a good chart for us, and certainly something that we want to continue to expand upon. I'll turn it over to Micheline. Are you going to do the next couple slides?
Sure. Good morning, Micheline Farag. So those upcoming 4 slides are basically giving us a full picture on the disbursements, the receipts, and staffing. So here we're starting with how we ended the fiscal year with our net budget variance at 2% that John mentioned earlier in his opening slide, which is the $259 million variance that you see here. This particular slide, we changed it a bit from previous meetings. Here it's showing you the variance, so it's more apparent to you, as John mentioned, where you could see the COVID impact. So the bar on the left in blue is our disbursements variance against budget, and the bar on the right in green is the net budget variance for the receipts. So the COVID impact here, you see that in the 788 or 789 million expenses that we have in the disbursements as a variance, offset by the receipts in green on the right as also a variance of 789. So basically what this is showing is the cash costs or our disbursements causing that variance of the 788 million. Obviously, we didn't anticipate COVID, so it wasn't planned for. So what you see you see there's a big negative variance on the disbursement side and a big positive one on the revenue side, where we have received dollars and federal relief dollars offsetting those expenses that went out the door in fiscal 20. Patient care receipts is something definitely worth talking about here. We came in at $166 million better than projected. Definitely inpatient revenue due to our COVID cases being higher acuity cases are the dollars that carried that patient care variance through or against budget. We came 11% better than planned on the inpatient care side, and that offset our losses that we saw on the ambulatory or the outpatient direct patient care side and some of the risk payments. So that's the view here. I don't know if there are any questions before we move on to the next one.
No. Please go ahead. We're going to do questions at the end, so if we can just get through the presentation, we're a little behind, so thank you.
Well, yeah, so the next couple of slides are showing our staffing story. So what are we seeing with our staffing here? This is our global staffing view, or our global FTE view. So what that means is that it's showing our payroll staff, hourlies, overtime, affiliates, and temps together to show where do we land. So we landed at plus 598 here across all buckets. The things to note here, one is our focus on reducing temps and converting some of those temps who are really operating at a full-time capacity to full-time staff, stabilizing again our workforce. And real quick on the overtime side, we definitely see our overtime at 135 going up with our housekeeping, our EVS housekeeping service aid staff. Clearly with the COVID surge, you see some of that impact here. John mentioned earlier, we're working on the EVS model where you will see some of that overtime turning into some full-time staffing needs on that. There are also some facilities titles in there that you see in the overtime, again, as anticipated with the COVID surge needs with our facilities and housekeeping. So the next slide, we dig a little deeper into our the full-time, part-time staff. Again, tying into what John opened with here, you basically see you have nursing and nursing support staff added at 116 for RNs and 138 for nursing support. Right under that, you see a line that shows you the 2-year growth. So the growth from the start of fiscal 19. You see, again, the great investments made there, 542 nurses and 367 nursing support staff that have been hired over that 2-year period. The next few bars are basically showing you the funded business plans. You see that at 146, some of our revenue cycle initiatives efforts. All these obviously have offsets on the revenue side. The conversion we mentioned before for the temps, you see some of the impact here with the clerical titles. Those are the main titles that were impacted by that. And then the last bar is just showing you the distribution or the increases that we've had, again, on the EVS side, which is housekeeping service aides, tech specs. That's a mix of titles that are basically relating to pharmacy, pharmacists, other types of, and technicians, I should say, clinical support titles included in there. So if there are no questions, so the next one is our revenue view, and Salima will take us through that.
Sure. This is a little bit of a repeat of what John mentioned earlier, drilling into just direct patient care. We came in $500 million higher than FY19. It can be attributed to a couple of different things. One is that obviously the COVID patients had higher acuity and we got paid better for them, but we also had increased Medicare rates, and then, all of our successfully implemented billing cycle and other revenue initiatives. And you can see that illustrated in the CMI. Our CMI is up 15% year over year. And so you can see in the charts our performance from prior year.
So I'll quickly go through the rest of these. Jose would like us to, to move it along, and I know you have a full day and we have more stuff to cover here. But just quickly on the FY21 budget, we'll come back with more details the next time we meet. But I can just quickly summarize that, Dr. Katz and senior staff post-COVID, we got together and decided, okay, where is it that strategically health and hospitals, should be going, and it required, a thoughtful review, and certainly took into context, COVID and our role in responding to COVID. But here you can see these are the major elements that were built into our budget, and we have over 300 million in savings, in the plan, and we'll go through those details the next time that we get together. And then the last part here, the next slide. What we put together is using the major themes by which we developed the budget, which is bulleted out there. What we've been doing is from a binary perspective, determining what does success look like for us. If we're successful in each one of these initiatives, how do we move the system? And you can see there, these are the major elements in what we have to do, to accomplish the financial plan. So that's the budget, and then maybe we can quickly go to FEMA for a couple minutes, and then T2.
James will do the FEMA.
Okay.
Sure. So on our COVID-19 federal relief and FEMA slide, so as of August 31st, we've paid out over $1 billion related to our COVID-19 response. To date, we currently expect our total cost related to the first wave to be at approximately 1.6 billion. Obviously, it depends how things ultimately, come together with COVID, but that's currently where we stand. I think since our last meeting, we did receive the $199 million FEMA advance that we had been anticipating since our first submission to FEMA back in late March. So it was very welcome news to get that. As you see here, there's a second drawdown package, which I mentioned briefly earlier, our temporary staffing, which we've expedited to FEMA. It will hopefully yield about another $250 million, and we sort of asked for a review that can allow the funds to flow so that, it can stabilize our cash and help us, offset the many expenses that we've had related to COVID and specifically to temporary staffing. Switching to the CARES Act piece, we've had about we've received about $1.2 billion in revenue so far from the various allocations you can see here, most notably the hot zone and safety net allocations. We've heard in recent days that there's potentially another $20 billion, a general provider relief allocation that might be available, an application open this week. So we're reviewing that to see what our options might be and what we might be able to earn, and we'll hopefully have updates at future meetings. In addition to that, we're always hopeful of a possible federal relief bill, and we continue to believe that it should prioritize high Medicaid safety net hospitals like ourselves, in addition to state and local relief, to help us offset or stem any cuts to Medicaid or otherwise that we might have expected, as John noted earlier, with the state's challenges and what they have proposed. So I think that's broadly where the federal relief stands, so we can continue to move forward.
Hi, this is Krista Olson. Just moving on quickly to test and trace. Through August, H&H has paid out approximately $75 million of about $280 million in committed expenses. The city has provided H&H and will continue to provide us with sufficient funding to cover these expenses. And then with the additional programming needs that have arisen and will undoubtedly continue to arise, the city and OMB and us with them are carefully monitoring the funds that are available to ensure that we are able to work with them to support these needs. Though there are no additional federal funds beyond the ELC grant and FEMA that have been announced. So working within the confines of that, we work with them to support whatever needs arise.
I think that's what we have, right? I think, any questions?
John, is that,
Yep.
so,
Yep.
okay. Thank you guys very much for a very comprehensive briefing. I know we had to rush through some things. I just want to make a couple comments and then I'll open it up for the committee for their questions. But first of all, I just want to say how very impressed and proud I am of the entire finance team. I know you are continuing to do a phenomenal job managing the very limited resources we have and maximizing the opportunities to enhance revenue and rationalize costs. So, you know, that we were able to come through this crisis with a positive net budget variance and manage to continue to execute on many of the transformation plan initiatives, that's quite a statement. So I just wanted to take a moment to say that. I know we're not out of the woods by any stretch, and you continue to adjust and adapt, and I'm just really impressed. And you're taking the opportunity, I know, to, as you mentioned, discuss, accelerate a lot of the initiatives that were already in the works and getting some of those things moving in terms of enrolling and converting new lives and talking to the state about the UPL conversions and insurance companies. So I look forward to having an opportunity to talk a little bit more on 2021 and getting your reports on how that's going. And I appreciate the update on the cash. I know that is you guys are very aware of the potential for a second surge and what that would mean for us financially. And you're working hard to make sure we're in as strong as a position as we can be. So the initiatives on trying to get the DISH money and the federal dollars is really important. I think it might be on that point just helpful to highlight for the committee members a little bit on that cash projection for October. And it's a very tight number. And so can you give the committee just some context historically on that?
Yeah, I can, and I'll turn it over to James. I mean, we thought it was important in this letter that we sent to the state late last night. We were very clear. We commonly provide our cash flows to them, so they're aware of, you know, our situation from moment to moment. I think there's a willingness there for them to be helpful. James, in the chart that we provided, right, we listed out, you know, the days cash on hand, you know, prior to, right, any new expenditures that might occur. Do you have that handy in terms of the days on hand?
Right. It remains to be about 18 days cash on hand, you know, through the period. It ebbs and flows a little bit in November and December if we can get normal revenues, but stays about that average of 18. And the reason, you know, in part that it dips so precipitously in October is that it's a 3 payroll month for us. And as you know, our biggest individual expense is salaries and payroll. So when we have a 3 paycheck month, that obviously consumes our cash a little bit quicker. But because we're aware of that, we can plan for it.
And just historically, James, is 18, you know, October is historically a low month for H&H, right?
Yes, October through December historically is probably our lowest period. You know, we normally get a large DISH infusion of over $500 million in January, part of which is what we're asking to advance to the October to December period, just given the uncertainty around COVID.
Mm-hmm.
But October through December is often our low point. And so, you know, it's something we're familiar with, but we just want to be extra cautious and extra, you know, cognizant of it this year, given COVID and uncertainties around that.
And I'll just also mention, you know, we're in the past, right? The city's always been a great partner for us. And I don't think, you know, today we can rely on them.
They're not
as much.
Right.
Right. They have their own problems. So, you know, we got to work together.
Right.
We're optimistic the state will respond, but we appreciate, you know, Frida, right, when we went over this.
Yeah.
You know, it certainly, you know, we have a solution. We just need to get there.
Right. Okay. Can I just one quick question on the T2? What was the total identified amount again? For what we had, the resources to pay for T2?
We currently have a budget of approximately $1 billion.
$1 billion, is
A
that what you said,
billion,
Krista?
about $1
Okay.
billion, yep.
Oh, that's more.
And yeah. And then some of these new needs will be added to that. That was
Okay.
kind of the original estimate. And then the funding that we have is about that amount. So working to adjust where needed
Right.
to cover those unanticipated, well, it's all unanticipated, but as
Yeah.
the new needs and program concepts get rolled out.
And I think we're going to be meeting with our team, right? The T2 team to recast the budget, right? And it's difficult to budget a pandemic, right? Things
Yeah.
are changing all the time. So, but we're trying, and I got to say, I think Krista's done a phenomenal job, and I think our city partners have also done a very great job. But we're going to need more money eventually, right? As the pandemic goes on and our response ramps up,
Right.
eventually we're going to need more money. But we're good for now.
Okay, good. I appreciate that. All right. Well, in the interest of moving along, let me poll the members for any other questions. Jose?
Just want to echo what Frida said and commend you on having to plan on the financial side through difficult times. So thank you so much for all the work you and your staff are doing.
Thank you, Jose. Sally?
Yes, if you were to project out to close of November and December, absent COVID or, new external expenses of some kind, do you think you'd stay at the 18 days?
Yeah, I can take that briefly. We would stay at about an average of 18 days. We at one point may dip as low as about 14 or 15 days, just given the ebbs and flows of revenue. But that's sort of what we're projecting, which is why we've certainly been in that position before, but we would prefer to be in a stronger position, and hence why we're pushing so aggressively for additional revenues.
And just echoing the compliments that have been given for terrific work done.
Thank you. Fenioski?
Yes, Frida, I'm okay. I don't have any questions.
Great.
Thank you.
Thank you. Okay, I think that's the full committee. So we are going to thank you, John and team. We're going to move on to two action items that are related. I think, Khaleesi, I'm going to read them together since I believe Linda and Pauline are going to discuss them together. So is that okay?
Yes,
right.
you're going to read them together and there'd be one discussion. And
Okay.
we vote separately on each.
All right. So I'll read them together, and then before I turn it over, I'd like to make a few comments too. But reading the first resolution, it's authorizing and approving the adoption of the resolution entitled New York City Health and Hospitals Corporation Health System Bonds 2020 Series Resolution, providing for the issuance of a series of health system bonds, the 2020 series bonds, in one, a principal amount not exceeding $100 million for new money purposes to finance the costs of various capital projects and expenditures of the New York City Health and Hospitals Corporation, the corporation, plus two, a principal amount not exceeding $340 million for the refunding of all or a portion of the 2008 series bonds and the 2010 series bonds. That's the first resolution. The second is authorizing and approving the adoption of the resolution entitled Amended and Restated General Resolution of the New York City Health and Hospitals Corporation, providing for changes that modernize the general resolution. So before I turn it over to Linda and Pauline, I just wanted to say a few words about this. H&H is preparing to enter into the bond market after an absence of many years, and this is a very exciting opportunity for H&H that I know the team has been anticipating and preparing for long before the pandemic. And fortunately, despite a great deal of volatility, and interest rates are still extremely low, there is good investor appetite and transactions are being well received in the market. In fact, I think New York City was able to get a $1 billion transaction billion plus done yesterday on the back of the downgrade, and it was very well placed, as I understand it. As the committee knows, we get most of our capital dollars from the city, but we do have a portfolio of H&H bonds or HHC bonds that are outstanding. Approximately 330 million of these obligations are now eligible to be refinanced, and that's why the team was preparing for this. And because the rates in the market are so attractive, we'll be able to realize significant savings. I think Linda will talk about this, of course, but it's currently estimated to be in the neighborhood of $50 million present value. And additionally, as we've talked before in Capital Committee and Finance Committee, Christine Flaherty and her team at OFD have been working on a comprehensive capital plan, and there's a significant amount of capital backlog that we need to accelerate. So this transaction offers us an opportunity to also fund a small portion of that need with no impact to our near-term budget at all. And the savings from the refinancing will, in effect, cover a significant amount of the money we will be borrowing. And the all-in cost of this, it's a maybe approximately 30-year transaction, is estimated right now at 2.25%. I know that Linda and Pauline will talk about this, but this is really at very historically low levels, and maybe only 2-3% of the time have rates been lower. So the team has done a great job making sure we're able to take advantage of this market opportunity, despite all that has been going on with the pandemic and everything else that we've had to manage. And I would also add that marketing of the bonds to the investment community right now is also a great opportunity for us to continue to tell the H&H story. So, and the one last thing on the second resolution is that is really a technical part of the transaction, but it also represents the team taking advantage of this opportunity. So these amendments will help us to modernize, as the resolution stated, and it'll give us a more flexible and efficient financing vehicle if we choose to enter the market again in the future. So I'll be quiet now and turn it over to Linda and Pauline to take us through the presentation.
Thank you. And thank you for all of your support and work through this development of this proposal with us. So Linda DeHart from the finance department here at Health and Hospitals. It takes quite a team to put this proposal together and to execute it. So we're joined by several people who'll be available to answer questions that the committee may have. That includes Pauline Locke, who is really the entirety of our in-house debt finance department. We're working with Morgan Stanley as the senior managing underwriter for this proposed offering. So we have Barbara Scudder and Joan Morgan from Morgan Stanley, and Will Brewster as well on the line, available to take any questions that you may have for that team. And we also have Brian Carter and Stephen Murphy from PFM, and PFM is the financial advisory firm to Health and Hospitals, is really an integral part of our team in evaluating these opportunities. So what we are presenting, there are several components of the proposal. First, to take advantage of the historic low borrowing cost, as Frida mentioned, to refund approximately $330 million of outstanding bonds. We, based on current market conditions, expect that could save $55 million net present value. We are also proposing to issue up to $100 million of new bonds to address our immediate capital needs. And we're taking advantage of this opportunity to modernize the language, which Frida also gave you a preview of. So based on discussion with the city in terms of timing when we can bring this to market, we expect that this transaction would occur in December. Forward. So some detail on the refunding opportunity. We, again, are really, yes, thank you. Really want to take advantage of the opportunity presented by the historic low borrowing cost, and we'll show you what that looks like sort of in a striking graphic on the next page. But it creates this opportunity for us to generate, at this, based on current market conditions, approximately $55 million we anticipate structuring these savings so that we will reap the bulk of that benefit in the next 4 years. So we have some immediate, really significant cash flow relief in terms of our debt service payments. The refunding focuses on the 2008 Series A bonds and 2010 Series A bonds. These are the only two that currently present opportunity for refinancing. We've done some sort of thorough look at our portfolio with Frida to assess whether there were other opportunities, and these were the two that stood out. So that savings that we generate from the refunding will help to offset the cost of this new borrowing. So we, as has been mentioned, have significant capital needs that have not been able to be fully addressed through the funding available from the city capital budget program. So we think that this is a great opportunity to take advantage of the savings that we're generating from the refunding to help offset some borrowing to help meet more of our immediate needs. The other thing we wanted to point out is that the refunding allows for release of roughly $19 million from the Capital Reserve Fund. This is a feature of our bond program where we establish a reserve fund for the maximum aggregate debt service that has to be paid related to those bonds. And because we have such significant savings from the refunding, we're able to draw down over $19 million from that fund, which in turn allows us to reduces the amount that we need to borrow to meet our needs. Moving to the next page, this is that snapshot of what current borrowing rates look like. So you can see, looking back over quite an extensive period and going, we sort of highlight towards the end, the last times that we were in the market, rates are significantly lower than they were then and really at almost all-time historic lows. So it really sort of behooves us to take advantage of this opportunity. And to the next page. So this is an example of the savings that we anticipate, as well as the overall, what our new debt service profile will look like after this transaction. And this, again, is an example based on current market conditions. We continue to monitor that, working with PFM and with Morgan Stanley. Based on conditions at the time we're actually taking the transaction to market, we may make some slight adjustments to this model in terms of how we structure the timing and the maturities of the debt. But this gives you an idea of what we expect the outcome of the transaction to be. And of course, should there be some dramatic change in market conditions, we would, reevaluate proceeding with the transaction in consultation with Frida and the city. So from the refunding portion of it, you can see if you look at the graph, the gray and blue bars the dotted line represents our current debt service payments on an annual basis. And the bars represent what they would be after this transaction. The blue bars represent the bonds that we're refinancing, and the gray bars represent bonds that are sort of untouched by this transaction. So you can see that from the refunding alone, we have a very dramatic drop. Again, concentrated in the first 4 years from our current debt service levels down to what we achieved through the refinancing. And then we take some of that room up in the first 4 years with the new funding. The red bars represent debt service related to the new borrowing that we would undertake. So that essentially, has a slight offsetting effect to our savings in those first 4 years where we've concentrated the refunding. And then there's a slight additional cost going out beyond that. And as Frida mentioned, there's sort of an all-in cost, which I think we discussed with Jose. You could compare to your mortgage rate kind of building in your closing cost of 2.22% on the transaction. Moving to the next page. We wanted to highlight for the board how we will achieve MWBE goals with respect to this transaction. So bonds are sold on a negotiated basis using the underwriting group that was appointed through our most recent process. You may recall we recently were before the board to extend the approved group of underwriting firms. And we also used the selling group that's used by the City of New York for additional retail sale capacity on the bonds. So we will establish a designation policy that will ensure that a minimum of 30% of the underwriting compensation is collectively delegated to the MWB firms among our approved group. So it's 5 of our 20 firms, and we've identified the 5 firms there for you. We also set a maximum allocation of 10% to any one of those 5 firms to ensure that there's adequate distribution among the firms. And just to note that by including the New York City selling group in the retail sales side of the transaction, there are additional MWBE firms that will have opportunity to participate in that business. Moving to the next page. This is a snapshot of the planned uses of the new money. As Frida said, and I'm sure the board is aware, Christine Flaherty's team has been doing a tremendous amount of work to assess the capital needs across the system, to evaluate priorities. We have submitted significant new need requests to the city, for a couple of years running now, and they have, assisted us as they can, but the capacity on that side certainly can't meet our full needs. So again, we thought it made a lot of sense to take advantage of this opportunity to get some additional resources to address some of our more immediate needs. So Christine's team, as well as supply chain, looking at equipment needs, have come up with a list of projects that are most immediate priorities, and also things that for the most part can be done within an roughly 18-month timeframe. And the bulk of it, I think probably over 80% of it, we expect to be able to complete even within a 1-year timeframe. So as we borrow these funds, they go into a construction fund, and we draw them down from there. So we didn't want to have that sitting for a very long time. So that was one of the priorities that the team looked at in coming up with these projects. So we work closely with both teams to manage the drawdown of these funds. And Christine Flaherty is here if there are any questions at the end, more detailed related to these projects. So we can turn to the next page. So the last part of the proposal is related to modernizing the general resolution. And the general resolution is the authorizing document for the system's bond program. So it was first adopted in 1992 and has not been amended since 1996. What it does is lay out all the terms and conditions under which the corporation can issue bonds, and those constitute terms and conditions that are agreed to by the bond purchasers. So to make changes in this resolution requires a majority approval of the majority of all bondholders. So by the fact of refinancing a substantial portion of our outstanding portfolio, we would have majority approval of bondholders through the purchase of these new bonds. So it creates an opportunity to update this document that we haven't necessarily had in the past. And the other thing to note is that the general resolution, so as I said, sets the kind of terms and conditions, and then specific financing transactions are authorized by the board through series resolutions that are sort of effectively amended to the general resolution. So turning to the next page, this is just a snapshot of some of the things that we tried. Oh, one back. Thank you. Of what we tried to achieve through the modernization. And it really is primarily updating terminology, updating definitions, updating the names of some of the entities that are mentioned, providing for use of modern technology, trying to reduce the use of paper, and clarifying things related to how the bond proceeds can be invested, what's the role of the trustee, adding some detail around the definitions of certain bond covenant requirements, just to make it a little more flexible for us in terms of our administration of the program, and also to sort of have things a little just remove a little bit of the lack of clarity that was there. We also established in this modernization that the general resolution only covers bond indebtedness. All other types of debt are still subject to board approval, but not necessarily need to fall under the general resolution through this more complex series resolution type of approval process. And finally, we allow for the use of balloon debt. And this was just adding some additional flexibility to the program. It would still be subject to board approval through the authorization under a specific series resolution. And that is not something that we're seeking approval for in this transaction. Moving to the last page. So just to summarize back what we're asking the board to approve, there are two resolutions. The first authorizes the adoption of a series resolution for the refunding of the 2008A and 2010A bonds, as well as the new money up to $100 million. And the second authorizes the adoption of the amended and restated general resolution with the modernizing language. And again, because of the requirement to have approval of the majority of bondholders, that would go into effect following the completion of the bond sales transaction. So in each instance, the board is approving a summary resolution that authorizes the adoption of the much longer resolution with all of the technical and legal language included. So that concludes the presentation. Happy to take any questions.
Sorry, I had to unmute. Great. Thank you, Linda. I'll go around and poll the members. Dr. Pagan?
Sounds like a great opportunity, and we've had conversations on this, so I have no questions. Thank you.
Dr. Katz?
No questions.
Sally?
You're on mute.
I just want to totally support the two resolutions and thank you for such a clear, lucid, detailed presentation on all that's involved with the resolutions, because it is very detailed and technical, but you've done a terrific job working with Frida and Christine and, our troops. I think this was a terrific presentation. I was wondering whether the resolution general resolution would require shareholder approval, and you've explained how that's going to be done. And my only question was, you've got 50 million coming off of the refunding and then 19 million on the general reserve. And I understand that part of the 50 is going to be used for the cost of issuance, but is the balance of that, must that be used for capital, or does that become flexible funds that you could use for expense or capital purposes?
In terms of the balance of the 50, it's flexible to us, so it's just freeing up cash for us.
And the 19 million from the general reserve that's freed up?
We're structuring the transaction so that we're using the 19 to reduce the amount that we have to borrow.
Okay.
To repay.
Thank you.
Great. Thanks, Sally. Fenioski?
No questions. Thank you.
Great. Thank you.
You are muted, so I think you are talking.
Sorry. I'll just go ahead and call for a vote then for the first resolution, which is the one authorizing the 2020 series resolution. Jose?
Yes.
Mitch?
Yes.
Sally?
Yes.
Benny?
Yes.
And I vote yes, so that resolution is approved. And the second resolution is the general resolution amendment. Jose?
Yes.
Mitch?
Yes.
Sally?
Yes.
Benny?
Yes.
And I vote yes, so that is also approved. I think that is all we have on our agenda. Any old business? Any new business? So there being no further business to discuss, the meeting is adjourned, and I thank everyone for getting through this in a very timely fashion.
Thank you.
Thank you.
Thank you.
Good job.